views expressed on this program are those of the hosts, guests, and callers, and are not necessarily those of this station, its management, or other advertisers. You're listening to Transformation Talk Radio.
Welcome to Lyme Talk Radio with Dr. Pat Basili. Epic healing for an epic life. This inspiring show highlights leading-edge solutions, groundbreaking research, headline topics, and tools for holistic healing and wellness. This hit show is dedicated to raising awareness, promoting advocacy and prevention, and supporting initiatives for optimal health. Dr. Pat is passionate and focused on life-saving results reaching far beyond Lyme disease, providing a forum for powerful stories, heart-opening experiences, and hope-activated solutions. Dr. Pat will shine a light on the many shades of Lyme disease fueled by a body-mind-spirit remedy. Now here's your host, Dr. Pat.
Hey everybody, I got to tell you, I'm really honored to be doing this show right now. You all have heard me talk about Dr. Nooshin Darvish. You probably have heard me tell the story of how I met her and how she saved my life. Today, she and I get to talk about what the journey's been like since that year, like a long time ago almost, that we met, and what she's doing today. So for those of you, she is medical director, naturopathic physician, and naturopathic integrative, amazing oncologist, Lyme expert, and much more. Now, why am I sharing all of that? You're going to hear from her about her passion, whether it's after graduating Bastyr University, teaching others, opening up Holistic Medical Center, expanding and growing. There's one thing I will tell you for sure. Chronic disease is no friend of hers. Well, she may say it is, but they got to be on the lookout because she will work until she finds a way to help people live an amazing life. Today, new possibilities for the treatment of Lyme disease. What have we learned? What have we done along the way to change? And what is the new narrative today that she practices every day in her practice? Dr. Darvish, it's great to have you here. And I only gave a little bit of teeny description of who you are because everything at drdarvish.com says so much more. It's so great to have you and chat with you.
Thank you so much, Dr. Pat. It is such a joy and a blessing to be with you again this time. It is just my honor and pleasure. So happy to be with you. And
Yeah.
you know, you bring so much life and excitement to everybody out there and also to me that I just want to share with you about what we do and about how we can transform people and what we've gone through in the last 20 years.
Yeah. Okay, so let's just tell the real story. I'm doing a show with the Angel Lady, and the Angel Lady says to me, and this is back in 2004 when I was like mystery disease, right? And the Angel Lady says to me, the angels say you have to Google, this is now like 2004, you have to Google T3. And then find a doctor that administers T3. I don't even know what T3 was. I Googled it. There were two doctors, you and another doctor I don't remember. And I thought right away, I'm going to her. And so I went. Remember the building you had over by Overlake? Remember that little building?
Yes, right? I do.
Okay. So I get on the books, come to see you. And I tell you, I think I got a thyroid problem. And you say something to me like, the good news is you don't have a thyroid problem. The other good news is we're going to figure out what you have. So it was, in your words, something like that. But then we went on this journey, a body, mind, spirit journey. And that is why I'm actually here today with you. I must say that before meeting you, I don't think I knew what naturopath was. I thought naturopath was some form of some mental illness, honestly, back then. But my life changed, and you're changing other lives. So where have we gone from that place in 2005 to where you are now in saving lives?
It's a progression. Unfortunately, I've seen so many more sicker and sicker people today than I did then. It seems like the rate of diabetes and heart disease, and not to mention Lyme disease and cancer, is just exponentially growing. And complicated patients, it used to be they would come in for T3 and you fix the thyroid and they're good to go, right? Or they had a little bit of a headache and you would fix their food allergies and away they went. But now it's the hormones, the emotional stuff that's going on, the neurological dysfunction, the mitochondria problems, the cellular energy issues. I mean, the list goes on and on and on, and the multiple infections that are bombarding our system. And so, we have to keep up with the current times, with the current conditions. And my passion has always been to transform lives, and not only lives, but from within. I don't want to just treat superficially and give you a pill and say, okay, you're done, you're good, your symptoms are gone. I really want to get to the root of what's going on. And oftentimes it's complicated. We are complicated beings. We're now recognizing the transgenerational emotions and toxins and cells and all sorts of things that are passed on from generations back to us. But the beauty of it all is that I believe we, as a society, as individuals, we have the capacity to transform, and not only transform ourselves and our health and our well-being, but to help transform the generations forward. And that is what is so powerful and keeps me driven to keep healing, helping people heal.
And I remember when I met you, your children were like teeny weeny children, like really, really young, right? And then I remember, we had your daughter on the show, and these children are now grown up. Also, part of this is your inspiration in looking at your children, your family, and your relentless ability to provide a solution. And that's what is so important to the show today. You just don't quit. And what is it about that works for you? Why is that so important for you to be so committed and dedicated to helping people that walk in like me, that we've been told we got like some mystery disease?
I believe I have a duty, an obligation. And part of that comes from my great grandmother. And I don't know if I've ever shared this with you before, but my mother's mom was a naturopathic, holistic, whatever you want to call her. She was a physician back in Iran, in the city of Yazd. And she would help and heal people. In fact, the mayor's wife was passing away and was being buried, actually. And she stops them on their way to her burial and stops the coffin and says, hey, let's look what's going on. And she brings this woman back to life.
Wow.
And there's so many stories like that about her. And I just have this very strong intuition and blessing that she works through me to heal people. And it's not me. It's her. It's the power of God, the Holy Spirit, the Baha'u'llah, whoever you want to recognize as the supreme power up there is working through me to help these people. So I become just a hollow reed,
right?
A channel to help people. And I believe I've been given these gifts of learning, as we all have, right? And the capacity of intuition, and the capacity to multitask and learn the science and apply it in an art fashion, the art of medicine, to help people and to really individualize and recognize what each individual needs. It's not about me, it's about them. It's about you.
Yeah. Well, I want to talk about that because you and I have a really interesting grandmothers that taught us a lot of different things that really showing up now in who we are in the world, right? But the one thing I love about it is that, the passion and the purpose underneath all of that is to be there for others who sometimes cannot be there for themselves. Because and I know when you are sick, chronically sick or otherwise, you can't show up for yourself all the time. And we have to be able to count on people like you to help us and trust you. And I think that's why so many people come to see you.
Well, it's our mission. Really, it's my mission. It's Holistique's mission to transform and help people transform. And the bottom line is, we're doing this not for me, not for you, not for the current society, but for the future generation.
Absolutely.
Right.
We're gonna, yeah. I mean, and it's the future generation that we're already starting to see have, these cells that have been passed on that are carrying so many things that the body was not meant to carry.
But you know what? We're recognizing also now that the DNA, at one point we thought the DNA, the genes that we are given is what we're going to have to deal with. But now we're recognizing that only 10 to 12% of those genes actually need to express themselves. 88% of how we function, who we are, what our diseases will be, how our health will be, is based on our choices, our environmental choices, what we eat, what we do with our lifestyle, our meditation, our prayers, our exercise, our exposures to toxin, and above all, how we work through in terms of dealing with relationships and working with relationships. So, the essence of all of this is essential relationships, if you think about it.
Oh, yeah.
And how we heal those essential relationships. Those essential relationships are relationships with myself, with God, with each other, with our parents, with our children, with our friends, with our coworkers, employees, companies. These are essential relationships. As in humans, we cannot survive without these. So the more we can work at healing these relationships, the healthier we will become.
We're going to take a short break. When we come back, what is the relationship we have with our illness? What is it that we can learn when you hear the words Lyme disease? What is the relationship that must be cultivated for that to heal? We're going to talk about that and much more. Dr. Nooshin Darvish joining me here today. We're going to take a short break. We'll be right back.
Are you traveling most of your day? Do you want to take Transformation Talk Radio with you anywhere you go? Well, guess what? There's an app for that. Just go to the App Store on your Apple device or the Google Play Store on your Android and search Transformation Talk Radio. Catch all of our live shows no matter where you are. Thanks for listening.
What is a brilliant culture, and how do we create them? Why are they important? Claudette Rowley has created a breakthrough 5-step process to help you align your culture with your business strategy for exceptional results. Looking for a culture that drives organizational excellence? Listen to Cultural Brilliance Radio, the second and fourth Friday of each month at 10 a.m. Pacific and 1 p.m. Eastern on Transformation Talk Radio. To learn more or work with Claudette, visit culturalbrilliance.com.
Do you feel that there's a bigger, better life for you? Is there anything holding you back from living the life you were meant to live? If you'd like to find your life's true purpose and calling, join the world's foremost authority on primal spirituality, David Carshare, in Becoming a Sun Radio, emotional and spiritual intelligence for a happy, fulfilling life. Tune in once a month to Becoming a Sun Radio with David Carshare on The Dr. Pat Show and Transformation Talk Radio. For more information, visit davidcarshare.com today.
Transformation Talk Radio is dedicated to the education and awareness of Lyme disease.
Welcome to Lyme Talk Radio. I'm Dr. Pat Basili, the host of the Dr. Pat Show, and I am so thrilled that we've created this venue for all of you out there.
Dr. Pat Basili will be bringing the most innovative, groundbreaking information, research, treatment innovations, and stories from those it affects every day.
What we have heard is that you want to ensure for us that we keep positive, holistic, uplifting, transformative talk radio on the air. We're excited to bring you the contemporary conversations about Lyme disease.
We promise not to let the light fade on Lyme.
So fasten your seatbelts. We've got lots more to share with you in the weeks to come.
Tune into Lyme Talk Radio with Dr. Pat and help keep our mission strong on transformationtalkradio.com.
Brand consultant Jen Morgan is here with Radically Distinct Radio to help you take control of your future and maximize your brand's power to produce results. Whether you're an individual trying to reinvent yourself and launch a new venture, or you're an executive trying to reposition your company to modernize your sales and marketing programs, Jen Morgan and the RAD method empower you to play to your strengths and show up in the world as your most powerful brand. To learn more, go to jenmorgan.com. That's Jen with 2 N's Morgan.com, or call 206-972-5366.
Hey, everybody, welcome back. Dr. Nushin Darvish joining me here today. I'm Dr. Pat. And, we're talking about wellness, really. Today's show, New Possibilities with the Treatment of Lyme Disease. I want to say this. You all have heard me go into an absolute rant on some of the shows I've done about the state of Washington that I live in. And while there is some progress being made on their website, they no longer are saying that Lyme disease can't live here. It is a reflection of what's happening in the world, but that is not stopping people from achieving wellness. Dr. Darvish, give us an update on Lyme disease, what it is we now know today, or at least what it is, we're told today.
Well, originally it was thought that it was one infection treated with antibiotics for 30 days, and it's gone. Today we know the multitude of symptoms and conditions that we are facing today, anything from chronic fatigue to fibromyalgia to autoimmune diseases to brain fog to memory issues to Alzheimer's, Parkinson's, multiple sclerosis, even cancer, and the list goes on, can actually be a symptom of chronic multiple infections instigated by possibly Lyme disease, or the bacteria Lyme, also known as Borrelia. And we also know that when Borrelia enters, it enters usually either through a tick, which is most commonly known, but it can also enter the system through mosquitoes. And old statistics show that 70% of the mosquitoes actually carry some form of an infection. We also know that it can be passed on sexually, through saliva, through blood, and from mother to baby through placenta or through mother's milk. So anywhere that this bacteria, the spirochete, can hide, it can survive. Yeah. And we also know that from the ice ages that this is the oldest bacteria that we have record of. So it's become a lot more complicated as we learn more about Lyme disease, that it's, Lyme is really not a complete term for this condition. It's really a multiple system chronic infection syndrome. It affects every system in the body. It affects the skin. It affects the digestive tract. It affects the nervous system. It affects the sinuses, the neurological system, the eyes, you name it, the hormone system. It affects all systems. And so when patients come in to see me and I see that they've checked off, at least one or two things in every section that I've asked them to check out, to look to see if they have symptoms, I know that they're dealing with multiple infections.
Yeah. Yeah. And, it is really now we actually can outline the symptoms, because if we even go back 10 years ago when you and I first started talking about that, we didn't have the knowledge we have now, did we?
We definitely didn't. And it wasn't as accepted. Today, there's thousands and thousands of physicians worldwide that are now recognizing that Lyme disease and its congregation of symptoms and syndromes and infections is actually a big problem, and it's an epidemic. It's a silent epidemic. And many of us on the conventional side don't know much about it. We don't look into it. We kind of ignore it. And yet the scientific world, the PhDs and the universities across the country and across Europe and Asia are doing studies after studies looking into what these infections are, how it's affecting us, how can we treat these things, and hopefully reduce our risks in the future and create a more healthy society.
And, part of this, if we could just talk about this for a minute, one of the infections, let's call it Bartonella. We now have a lot more information about Bartonella than we ever had before. And, I was reading a study a couple of weeks ago, and the information now that talks about what that is, what it's doing, how it's completely overlooked. I mean, there just is now a whole new range to talk about. Wait a minute, maybe Lyme doesn't show up, but let's not ignore this thing over here, right?
Exactly. So they're what we call co-infections, Bartonella or cat scratch disease being one of them. But there's also Babesia. I call it Babesia. It's such a pretty name.
It is. It's really very. It does. It's like Babesia sounds like something really, really, like a seductive name. Bartonella sounds like a good wine.
Yes. And then there's Mycoplasma. And, lately I've seen multiple patients come in here with Mycoplasma, and they may have chronic respiratory or heart disease or sinus infections, and they may not know that they're carrying this Mycoplasma. There is chlamydia pneumoniae, and oftentimes when I say chlamydia, most people think, oh my God, it's the STD. It's not the STD, it's a respiratory bacteria that, again, can be tick-borne and respiratory-borne, but it starts off maybe with a bronchial infection like a bronchitis or pneumonia, or even just a simple sinus infection, but it can lead to becoming heart disease and causing chronic pain in the muscles and the ligaments and the tendons and so forth. So, and these infections, they sit quietly and just like cocoon themselves in what's called a biofilm, and they grow and multiply very silently. And then suddenly, when there is an emotional drama or trauma, when there is a car accident, when maybe even there is a surgery of some sort, or any kind of a physical, mental, emotional trauma, these infections just say, oh my gosh, wake up time, I have an open field, because the immune system goes down with all of those traumas and what I call dramas, right? And so these infections can just multiply and take off and affect the system. And then people come in here, the most common symptom I see is fatigue, just complete exhaustion. But then you also get these opportunistic infections, because these mycoplasmas and the Borrelia and the Babesia and so forth, they weaken the immune system. And as the immune system has weakened, then they open the roadway for other infections like chronic Epstein-Barr or mono to exist, or chronic cytomegalovirus to do its thing. And multiple other infections, parasitic infections and amoebas and Helicobacter pylori, and you name it, it just goes on and on and on. But then we get to a place where it affects our cholesterol. So now we are able to do testing of cholesterol particles, and specific particles in the cholesterol can indicate that the body's working really hard to kind of bust and shuffle these infections out of the system. And so you may see elevation in the cholesterol or depletion of the cholesterol levels. Right? You may see blood sugar goes up or blood sugar drop. You may see hormonal imbalances. Your adrenals are burnt out, or the estrogen and progesterone and testosterone, DHEA, all going kind of array, and people suffering from multitude of hormonal symptoms. So the list just goes, completely wild as to the number of symptoms can come in here and the multiple conditions they have.
And I want to get back to this, my famous angel reading that said thyroid. We would be remiss not talking about how Lyme or one of the co-infections can show up as thyroid. And, people carry thyroid around. And you know what happens with thyroid, right? You go to the doctor says, oh, yeah, thyroid, everybody's got it. But, don't worry about it. Even if it's cancer, it's slow growing. Just kind of sit there with those nodules and you know what? It's going to be okay.
Exactly.
But
And
that's it. That's the end of the story.
That's right. And, we can treat it symptomatically, but people are not getting better. They're still tired. They still have that brain fog. They still have slow reflexes. So what is going on?
Yeah.
Right?
Yeah. I want to skip the break because there's so much we have to really share and talk about. What I love about this is when we have the medical community saying, yeah, we don't see anything, and then people still die, it really raises a new level of awareness for everyone across the board. And I think that's what's happened, in our conversation. You've seen it over and over and over and over again with people just coming through. And most of the time, they've been to doctors that are saying something wrong with your brain. Maybe you're depressed.
It's all in your head.
All in your head. Well, yeah, you're going to be depressed if you're tired all the time and you got pain in your body. But now we have ways to approach it, diagnose it, and treat it. What have you discovered now in the treatment arena?
Well, Pat, I never stop, as you said. I never stop learning and figuring out things. I'm a problem solver. And so one of the best things that I've come across in the last decade has been ozone therapy.
Oh.
If you think about it,
I think I was one of your first ozone. I still have my Ozonator, by the way. But finally we're talking about it. Ozone therapy. Tell us about it.
Ozone therapy. It was discovered way back in the 19th century, in the 1800s, over 150 years ago. Can you believe it?
Yeah,
and it was discovered by chemists in Germany and Europe. And then it was used during World War I to fight off infections. Okay? But the first published study on it wasn't until the 1970s. It took them over 100 years before they figured out, we got to publish a study on ozone therapy. And what ozone is basically is 3 molecules of oxygen. It's a very unstable and reactive molecule.
Yeah.
And it's in our atmosphere. That's the way most people know it. And it really is there in order to protect us from all that UV radiation
totally
at us, right?
Yep.
But now we're recognizing how powerful ozone actually is. If you think about it, we can survive without food for days, weeks, right? People go on water fasts for weeks.
Yeah.
They're fine. But we cannot survive without oxygen. Give us a few minutes and we'll be brain dead.
That's it.
Right? We're gone. So oxygen is vital to every cell. Now, what happens is that when cells get deprived of oxygen, these infections can grow. And a number of them, like the Babesia we talked about, like the Mycoplasma we talked about, like the Borrelia, they survive in a low oxygen environment, just like cancer does. Okay? So hence, if you get injured, chances that you may get cancer or an infection growing around that area of scar tissue, or in Chinese medicine in that meridian, passing through that scar tissue is extremely high, because when we're injured, the scar tissue causes a lack of oxygen. Scar tissue doesn't have any blood flow, it doesn't have any nerves growing to it, and so it's dead tissue. And as a result, oxygen doesn't get there. And so it's a great environment for these bacteria and bugs to grow. So then we discovered ozone, right? You give it a little bit of an oxygen, poof, the infection dies, because ozone has the ability to actually disengage and deactivate infections, the bacteria, the viruses, the parasites, the mycoplasma, the yeast, the fungi, all of them. It disengages their cellular behavior, and it breaks down. Those bugs break down, and they can't survive.
How does the biofilm do with it? Because I've not read a lot about that. Tell us a little bit about ozone and that, because the research on ozone is that you can, as an example, you can, like me, I can cook up a batch of ozone water, which I drink, but I can wipe my counter down with it.
That's right.
Yeah, because we see hospitals using ozone to clean sheets, all sorts of things, right?
Well, if you think about biofilm again grows in an area of lack of oxygen.
Right.
Right. And you're right. There's not enough research showing whether biofilm breaks down with ozone. But from clinical experience, we've seen that happen.
Yep.
We've seen plaque buildup, break down with applying ozone oil on your gums and your teeth. The plaque starts dissolving. So we can see that it dissolves. Now, there's not enough studies yet, but that's because this is so new, so cutting edge, so amazing. I mean, think about it. Oxygen is God given to us. We thrive and survive on oxygen. Why can't we use it for therapy? Of course we can.
Well, I think you and I have had to do some research on this. And when we say ozone therapy, and I was reading about one of the German physicians, I don't know, what do they call him? The godfather of ozone. But I just gave a very simplistic perspective on ozone. I get my little ozone machine. It's got a little ceramic ball on the end of it. The ozone gas goes into the water. I actually can test the water to see what the ozone level is, and then I drink it. Now, clearly, that is not the only thing, and I don't even know if that helps. But now we've moved to many, many ways to use ozone therapy. Could you tell us about those?
Sure. Ozone, well, one of the things, let's go back to a little bit back to how ozone works, because it's not just about killing off infections.
Right.
What they're now discovering is that it actually repairs DNA. Okay. And what we talked about earlier, those transgenerational infections and toxins that are passed on to us, the damaged DNA that's passed on to us, we can actually help heal those cells, that DNA, those genes of ours. So cells are getting activated by this oxygen, and the microbes are dying, but it also activates and stimulates the glutathione, our body's ability to clean up all the toxins, and it helps relax the blood pressure and dilate the blood pressure. It helps reduce iron overload and reduce inflammation.
Wow.
And the beauty of it, it shuts down pain. So people with chronic pain, we give a little ozone treatment locally in that area, boom, the pain is gone. It's great for herniated disc. There is studies on disc herniation and ozone therapy. It's great for arthritis and autoimmune diseases. And the most up-to-date information is ozone and neurological diseases like Alzheimer's and Parkinson's and MS.
Yeah.
And so it has the ability to heal our cells, our body. Okay. Now, there's many different forms. Of course, ozonated water is great. It's a great disinfectant. But the best therapeutic effects we get is with what's called autohemotherapy, which is basically a blood ozone therapy. And what this involves is taking your blood, a small amount of your blood, giving it some ozone, and so you see this purple blood that is lacking oxygen become bright and red and oxygenated. And then that blood is given back to the patient. So it's their own blood getting cleaned up, basically, activated with life, right? And then it comes back to them. So that's what autohemotherapy is. It's a very powerful treatment.
Yep.
Now there's machines from Europe that are able to ozonate half of your blood volume, 1/3 to half of your blood volume.
I was going to ask
sitting.
you about that, because the old school machine, I think you can only do a little at a time.
That's
And
right.
so now, though, in a really controlled, safe way, right?
That's
The
right.
blood's being cleaned. That's
right.
crazy, isn't it?
It's awesome. It's absolutely awesome. It's called a 10-pass therapy. And basically, the reason it's called 10-pass is because we have a vacuum, and the blood gets pulled into this bottle that's vacuumed. And then under hyperbaric pressure, oxygen and ozone is pushed into the red blood cells. And then the blood comes back into the patient. And then it gets pulled up again. And then it does the same thing and back down.
Wow.
And so your body can do this, we can do this up to 10 times or until the blood clots, to really ozonate about 2,200 milliliters of blood, which is extraordinary. And with that, you're killing cancer cells, you're anti-aging, you're stimulating stem cells. We talk about stem cell therapy and going through all this procedural stuff that may or may not work. And yet, the ozone therapy stimulates and activates stem cells at a particular dosage. So one thing to remember is that ozone is very dosage dependent. Smaller dosages are more anti-inflammatory. Much higher dosages are much more antimicrobial to the system. So it's very, very specific to the individual. And it's like prescribing prescription antibiotic. I'm giving you, 10 milligrams versus 100 milligrams because of this reason. Or the same thing, I'm going to give you 20 gammas, or what's now called milligrams. Yes, per milliliter. Micrograms per milliliter, and at 200 amounts of volume, right? Or I may give you 70.
Yeah.
Right? And
but you're right. And this is what I want to be really clear about, is this is an individualized process. This is not a one size off the shelf. You got Lyme disease, 2 weeks of doxycycline, call me in the morning. This is different. This is the way different. Chronic illness has to be treated. We don't all get chronically ill the same.
Exactly. We don't have the same symptoms. We don't have the same toxic load. We don't have the same DNA. We don't have the same cellular function. We don't have the same cellular damage. And we don't have the same hormone function. And so ozone really needs to be very individualized for that individual with all the stuff that they're carrying. But we're talking, you mentioned different forms of ozone therapy. There is the blood therapy.
Yeah.
There is also rectal and vaginal ozone therapy. So in Europe, they're finding that when they do blood ozone therapy and it improves patients to a certain amount, as soon as they introduce the rectal ozone therapy or the vaginal or the combination, in combination with the blood ozone, suddenly the patient is even more revived. The infections are even killing off and dying off faster, and the body's cleansing itself much quicker. Then there's ear ozone. When you have infections in the ear canal, we give ozone there. Skin, oh my gosh. This patient of mine, a 95-year-old woman, came into my office. Horrific infection of the bone of her middle finger. And the infectious disease doctor had sent her over to the amputation doctor saying this needs to be amputated, otherwise this woman's going to die. Well, this woman refused amputation, and she just wanted ozone therapy.
Wow.
So you should see her finger. This is 95 years old. Her finger has healed. The bone has healed. And not only that, her mental clarity went way up. She is smarter than I am, than you are, than all of us together. She's amazing. And because she's done so much ozone therapy to heal this finger. And in the midst of all of this, she's regenerated cells, stimulate her stem cells, and it's fabulous. So treating the skin with ozone is a possibility for sure. And that's what they initially started off in U.S. doing in World War I, was using bagging to treat ulcers and
Right.
with
Right.
ozone, right?
Right.
And now there's a whole new science of ozonated oils. And the reason I say a whole new science is because ozonated sunflower oil at a particular dosage is going to have a different behavior than olive oil at a particular dosage. You know, every oil has a different capacity for healing and for its antimicrobial properties. So
Yeah. Yeah. Somebody, Dr. Darvish, somebody told me the other day, I got a text from somebody or an email from somebody, was just talking about this with cannabis oil. They were telling me that somebody has created an ozonated cannabis oil. And I'm thinking to myself, this is really, we have entered into a new age, which is actually an ancient, let's just be really clear. It's a new understanding, a new age of understanding about ancient healing.
Exactly. And it's amazing as we're learning about what these things do, how we can incorporate it, how new methods are being developed based on 150 years ago, ozone therapy, which we kind of just ignored because then the pharmaceuticals came into play, the antibiotic companies came into play, and ozone at its simplest, most affordable system got forgotten. Right?
I know. Let's take a short break. We come back. We're going to talk about what it is that we're looking at that is literally giving people relief. What's involved? How can you find out more? And what are some of the case studies that are now showing up for ozone and AIDS? I mean, am I even talking science? Yes, I am. Stay tuned. We'll be right back.
Tune in to The Jen Royster Show, intuitive guidance to inspire your life, each Thursday at 8 a.m. Pacific and 11 a.m. Eastern on TransformationTalkRadio.com. This amazing show is an inspirational hour that will take you on an epic metaphysical journey to discover the spiritual approach to life's greatest challenges. Dr. Jen is an internationally known intuitive counselor, spiritual teacher, and energy healer. Call in for intuitive readings and visit JenRoyster.com for more information.
How would you like increased health and vitality? How would you like to avoid the onset of disease as well as slow the aging process? This is all possible through a simple, safe, and natural process. Every day we are either moving toward wellness or away from wellness.
Hi, I'm Mary Jane Mack. I'd like to be your partner in achieving optimal health. Contact me now at maryjanemack.com or call 425-392-0659. Visit maryjanemack.com.
Transformation Talk Radio is dedicated to the education and awareness of Lyme disease.
Welcome to Lyme Talk Radio. I'm Dr. Pat Basile, the host of the Dr. Pat Show, and I am so thrilled that we've created this venue for all of you out there.
Dr. Pat Basile will be bringing the most innovative, groundbreaking information, research, treatment innovations, and stories from those it affects every day.
What we have heard is that you want to ensure for us that we keep positive, holistic, uplifting, transformative talk radio on the air. We're excited to bring you the contemporary conversations about Lyme disease.
We promise not to let the light fade on Lyme.
So fasten your seatbelts. We've got lots more to share with you in the weeks to come.
Tune into Lyme Talk Radio with Dr. Pat and help keep our mission strong on TransformationTalkRadio.com.
Chris Stanis is a spiritual leader and healer and teaches a course on how you can transform your life through a meditation and healing system that will manifest your spirit's dreams. She manifested the Women of Wisdom Conference, the Women of Wisdom book, and this radio show. And she can show you how to change your life too. Are you ready? Visit the website and contact her at voicesofwomentoday.com. That's voicesofwomentoday.com.
Did you know that all of the shows on the Transformation Radio Network are available as podcasts to stream or download?
Really?
Check us out. Go to transformationradio.fm. We have business shows, spiritual shows, energy healing shows, and pretty much everything in between. Something for everyone, guaranteed to inspire, educate, and transform. We are transforming the world, one listener at a time.
Hey, everybody, welcome back. Dr. Darvish, before we even go any further, how can people find out more about you? Website, phone number, all of the above.
So our website is holistichealth.com. That's the French spelling, HOLISTIQUE health.com. Or you can go to drdarvish.com and it'll take you to the same website. We do have a Facebook page that is under Holistic Medical Center that you can look up, and once in a while we will post stuff. In fact, we just posted something on ozone, and we do have a blog on our website that we will post occasionally some up-to-date information about different therapies and herbs and conditions out there. So trying to keep the public aware and educated on what's out there and what can help them heal. So that's holistichealth.com. And our office number is 425-451-0404. 425-451-0404. We are in Bellevue, Washington. And one of the new things that we have been doing is telehealth. So I do a lot of Skype and phone consulting with patients across the world, actually.
Yeah.
Locally, globally, nationally, and globally. So patients and people, whoever wants to discuss, are more than welcome to call and set up an appointment to have a consult.
And I think it's really important we're communicating. I shared with you that one of the things we're doing is we're creating a game. And we got permission from the Exploding Kittens people who created the card game so that we could create exploding ticks to educate people. Everything
That's
from
awesome.
Preventative. I know. My friends, our professional people are like, oh, you're really not going to do that. And I'm like, yeah, I really am. But getting back to this, what should people know about ozone? They don't even know how to ask. Most of the time, they don't know how to ask. They don't know. What do we do with this from a doctor's point of view? And then I want to also have you touch upon, have we made any progress in testing?
So, in terms of the ozone therapy, I would say 99.9% of the doctors out there don't know much about ozone therapy. It is considered experimental in USA. However, in Europe, it's part of their protocols to treat all sorts of conditions. So in US, unfortunately, we have all this red tape to go through, and it's considered experimental. But it is very, very safe in terms of, the blood ozone therapy, the rectal, vaginal, ear ozone, all of the skin ozone. You do have to be careful about inhaling ozone because
I didn't know that.
Yes, ozone can damage your lungs.
Mm-hmm.
It can damage the cells in your lungs. So that is where the negative aspect of ozone comes from, is people think when we're doing ozone therapy, we're having them breathe. There's no breathing. In fact, if there is any exposure of ozone in the clinic, I have people wear masks to make sure that they're not breathing anything in. So it is a very, very safe treatment. Sometimes it does cause detox reactions, or what we call Herx reactions. And that tells me that we need to optimize the detoxification system in the body even further. Keeping in mind that ozone itself does actually activate your liver detoxification system. So what's called phase 2 detox gets activated by ozone. So here's the beauty of ozone is that it's not only killing things and repairing things, but it's getting things out of your system, which is fabulous. The benefits of ozone are comparable to moderate exercise. If people do too much exercise, they're actually damaging their cells.
Right.
But moderate exercise is healing, rejuvenating, oxygenating, repairing. And that's what ozone therapy does. Except sometimes when we are very sick, oxygen therapy, exercise therapy is not enough. We actually have to give direct ozone therapy. So ozone is very, very powerful. And it's very, very exciting.
It is exciting. And, you know, you and I have gotten to, and I certainly have gotten to do my own experimentation. And thank goodness we don't have to do that. A topic I think I have a few minutes to chat with you about. Here's what I'm finding, and I'm getting this from listeners all over the world. One of them literally said to me, there's something to be said of not knowing. I said, why don't you just go get a test? I can send you to a doctor, give you a good test. They're like, no, I'm okay. My doctor said I don't have it. And so this is an interesting, and from my background, right, psychology background, this is, I think, a real problem. Denial because of no hope seems to be the direction rather than actually get a diagnosis. And we have to turn that around.
You're absolutely correct. You know, I think knowledge is power, right? The more knowledge we have, the more the gems are instigated within us, brought forth, the more we have the capacity to be able to heal and transform. So knowledge is power. And it doesn't mean that, you know, you get diagnosed with rheumatoid arthritis or cancer and your death sentence is given to you. What it means to me is that we have work to do, girl.
Yeah.
Right?
Yeah.
And what we have to do is we have to clean out a lot of the toxins. And I'm talking about physical, mental, emotional, psychological, spiritual, whatever it is that we're carrying, generational, clean the house. And as we're cleaning the house and reestablishing balance, and that is the key, is to bring back balance within the body. We all have bugs in our system. We all have hormonal dysfunction in our system. We all have cells creating toxins, but we also have cells creating balance, detoxifying. We have hormones that are rebalancing our system. We have emotional drama that is your body's constantly trying to regulate. We have a nervous system that is trying to re-regulate and regulate itself every second, every tenth of a second, constantly. You and I are talking here. We're getting exposed to all this electromagnetic field. Our body is constantly reestablishing balance. And the key is, how do we bring back that balance? Right? How do we bring back that balance within the cells, within the nervous system, within the psyche, within the spiritual realm? And the more we can work on all of those, the more our body creates health and releases the toxins and the diagnosis. We can reverse diseases. We know that now. We can reverse chronic disease.
Yeah.
It's not an impossibility. And I think people are not aware of that yet.
Yeah.
That we can reverse chronic disease. You know, one of my favorite quotes from the Baha'i writings talks about how when we as doctors are able to relieve people of their enslavement to their appetites, to their lustful appetites, that we can be free of chronic disease. So think about, what are all those lustful appetites that we're addicted to? You know, sugar.
It's the entire. It's the entire addiction to not enoughness. Not enoughness. Not enough sugar. I got to have more sugar. Not enough alcohol. I got to have more alcohol. Not enough to, you know. I mean, what you're talking about is there is an addictive nature that we think is helping us because it's numbing us.
Exactly.
Whatever you think it is.
And this is a whole new show.
It's a whole new show because, you know, and I want to kind of wrap it up with this, because my question for you is, if ozone therapy can do this, my thinking is, another area I'm involved in, is why aren't we using ozone therapy to detox drug and alcohol addiction?
Some do. Some do.
Just asking the question.
Exactly. Some do. It's just not in the conventional medical realm just yet. You just wait.
I am going to wait. Dr. Darvish, what a great conversation, and we are going to take that next show to that level. I want to ask you two things. One, please let folks know how they can contact you again, and then also, what's your personal message? What would you like to leave us with today?
You know, breathe. Just
no
breathe.
Kidding.
Get that oxygen, and know that there is hope out there. for chronic disease, including cancer. There is hope. And you can contact us at www.holistiquehealth.com, HOLISTIQUE health.com, or drdarvish.com, drdarvish.com, 425-451-0404, and we'll be more than happy to help you transform your life.
Dr. Darvish, thank you so much for today, and thank you so much. Dr. Darvish and I are going to be continuing the conversation as we always do. And I want to thank you for all that you do in the world, and I want to thank you for saving lives, because in the end, that is what this is boiling down to, saving lives so that they can be thriving lives. Thank you for that.
And thank you, Dr. Pat, for all you do, because you are a vehicle for us to survive and to thrive.
Awesome. Thank you all for tuning us in, turning us on.
Thanks for listening to Lyme Talk Radio with Dr. Pat Basili, Epic Healing for an Epic Life. This inspiring show highlights leading-edge solutions, groundbreaking research, headline topics, and tools for holistic healing and wellness. This hit show is dedicated to raising awareness, promoting advocacy and prevention, and supporting initiatives for optimal health. Dr. Pat is passionate and focused on life-saving results reaching far beyond Lyme disease, providing a forum for powerful stories, heart-opening experiences, and hope-activated solutions. Dr. Pat will shine a light on the many shades of Lyme disease, fueled by a body-mind-spirit remedy. For more information, visit LymeTalkRadio.com and tune in next time.